Hey friends, welcome to another episode of A Diary of a Medico, a series where I share some of my experiences, insights and memories as a medical student. Today's episode will be filled with stories of death, life, revival and the different miracles which I am glad to have been part of. So do watch this video, enjoy it, like and subscribe to this channel for more such videos. An experience I'll never forget was one which happened during my medicine postings. So it was a regular day where we were taking cases in the medicine ward when a patient was admitted. It was a young man in his mid-30s who was admitted with a large swelling over his left limb. Now usually when you have patients with such a large unilateral swelling of the leg, it could be conditions like cellulitis, which is a bacterial infection of the skin, or a condition like deep vein thrombosis where the deep veins inside your leg gets clogged. The problem with these conditions is that they have really serious complications like sepsis in the case of cellulitis, or a condition called as pulmonary embolism in the case of deep vein thrombosis. What this means is that a clot can just ascend from your leg all the way into your heart and from your heart all the way into your lungs, blocking one of the main arteries known as the pulmonary arteries, leading to a condition called as pulmonary embolism, which is a deadly fatal condition. So we were just doing our regular job taking cases in the ward. On the day there was a single junior resident in the ward and he was responsible for taking care of 50 patients. So the young man was having a normal conversation with his family members and they were chit-chatting about regular things. They were all sitting beside him on the bedside until the man suddenly became unresponsive. So they immediately called the junior resident. The junior resident rushed to the bedside, checked for his pulse and respiration, and there was no pulse, no respiration. Now a little backstory. A year ago I went for a trip to Mysore where I actually did my certification in basic life support. So I am an AHI certified basic life support provider, which means I am certified to provide CPR. Now I never had a prior experience doing CPR on an actual patient, but from what we have learned, you have to initiate CPR when there is no pulse or respiration in a patient. Since there was no one around to help, the junior resident immediately called us and asked, is there anyone who knows how to do a CPR? And I just stepped in. So me and the junior resident started giving CPR to this patient. We took turns. Meanwhile, the nurses just rushed to the bedside. They started him on adrenaline. They gave IV fluids. They started giving glucose. They tried everything, but still on the cardiac monitor there was no heartbeat, which means he was in a state of asystole. The issue with being in asystole is that you cannot even shock the patient. Now you might have seen in movies that thing where they just shock the patient. That's not even possible in a case of asystole. So me and this junior resident along with one of my friends stepped along the way. We gave continuous cardiopulmonary resuscitation for 20 minutes. Believe me, it's very hard to maintain CPR on a patient for 20 minutes because firstly it's a tiring procedure. Secondly, you have to do it efficiently and correctly every single time, because otherwise the procedure would become extremely futile. The purpose of doing a CPR is to take over the function of the heart and to take over the function of the lungs so as to maintain adequate blood supply to brain, which is the most vital organ. Unfortunately, despite trying everything and giving our best efforts, we were not able to save the patient. And this was a really eye-opening moment for me as a medical student. Firstly, it taught me how unpredictable medicine could be. It taught me how attentive a medical professional must be during his work, because anything can happen anytime. It's an extremely unpredictable profession. And this is not even the casualties or the emergency duties. It's a regular day in the wards, and even in the wards, these kind of uncertainties could happen. Secondly, the more difficult part which I realized was it was not just the fact that a young man in his mid-30s has lost his life. He is newly married, he has young kids to look after, and he has now passed away. But what is also hard is to break this news to the family members who are just, standing helplessly beside the patient. They were just having a regular chat just a few minutes ago. A death was the last thing which they were expecting in that moment. But nevertheless, life is unpredictable. We as doctors have our own limitations and we lost that patient. Over to the next incident. Since I've said a really sad, unhappy, traumatic story, I would like to cover that up with a really happy moment. I would now like you to take back to that place in the hospital where life originates. Yes, I'm speaking about the labor room. It was during my first night in the LR, a few hours after the midnight, when a young lady of around 20 to 21, she's just been married the past year, came into the labor room. She was due on date. There were no complications in the pregnancy, and the house surgeon called me to assist the delivery. Now, I had read about the different stages of labor and the different 7 steps which happen during the birth of a baby, but this was my first time experiencing it and having the opportunity to conduct a labor right with my own hands. I will never forget the moment that baby just came out of the mother's womb, and I was the one that was holding the baby. I was extremely tensed in that moment. I did not want to make any mistakes. 2 lives are at stake. The condition in the labor room, as you might expect, it's lots of noises from the mother's side, from the doctor's side, telling the mother to push the baby and so on. But Alhamdulillah, by the grace of God Almighty, the delivery went pretty well. And the moment the baby cried, I would say it is one of the most satisfying moments a person can experience in his or her lifetime. In that very moment, you will just forget every single chaos which just took place up until that moment. It's extremely satisfying knowing that the mother and the baby is safe. Not only that, we had to do an episiotomy for that patient, which is basically a surgical incision which we'll put in the perineum of the patient so as to expand and provide more room for the baby to deliver. Now, the house surgeon was kind enough and he told me to suture the episiotomy incision. So after the baby was delivered, the cord was cut and the baby was taken away, I stayed back along with him, assisting on my side, and I was suturing the episiotomy, which again I would say it's a great experience. What was special, however, was the fact that midway while I was suturing the episiotomy, the patient said she wanted to defecate. She wanted to poop. Now, when a patient wants to urinate, it's simple. We will just put a catheter and the catheter will drain the urine. But when a patient tells they have to go to the toilet to poop, it's an awkward situation. You are in the middle closing an incision. You can't leave the patient. The only thing that you can do is to tell the patient to control. But unfortunately, that patient could not control the urge to defecate, and the patient ended pooping out right in front of me. Now, fortunately, the poop did not get into my scrubs, but with the position that I was sitting and with the position that we do an episiotomy suturing, you can pretty much guess I was really close. The house surgeon beside me said, "You are actually a very lucky man. I mean, in the sense, in your very first patient, you had to go through such an experience." Nevertheless, it's a moment that I will never forget. It was an extremely fulfilling moment, and over the next 28 days, I was fortunate enough to conduct the delivery of 4 more newborns. The next incident is the one which happened very recently, and in fact the one that inspired this video. So we were having our final some surgery postings. It was a day where there were no house surgeons and no postgraduates inside the OT because they had a strike going on for a stipend issue. There was literally no one to assist the professors in the surgery, and they were having a staff shortage. So us final year medical students were asked to scrub and enter the operation theatre to assist. I was lucky enough to get my hands on and assist in my first laparoscopic surgery ever. Now, you have to understand that to assist in a laparoscopic surgery during your undergraduate days, you have to be extremely lucky. It is not something that every student gets to, but it is something that most students dream of doing. So the surgery was a laparoscopic cholecystectomy. I scrubbed in. The assistant professor, who was extremely kind and supportive throughout the procedure, he did the surgery. I was the one who was providing the traction and maintaining the gas levels, while the senior resident was the one holding the camera. Now, I was a guy who was never really into surgery prior to this incident. I was always a medicine guy, and medicine was a subject which stimulated me. But after this experience and the kind of support my assistant professor showed towards me, I am now kind of thinking about taking surgery as a future option. He was really happy with the way I assisted, and he really spoke highly about me to the associate professors and even to the HOD. So it kind of felt nice. Who knows, I might end up as a surgeon someday. Anyways, I just forgot to mention about the case which I operated on. It was a case of a laparoscopic cholecystectomy, which is basically the removal of gallbladder through a keyhole. Now this is done when there is either inflammation of the gallbladder or when there are stones in the gallbladder. This was a female, she was around in her 40s. It is a classic description that we learned in our textbooks. It was a textbook case, but the surgery was not so easy. The patient had a short cystic duct, which meant that it was very difficult to approach and access that area. Nevertheless, the surgery went really well and the patient was fine. Another surgical experience which I would like to share goes back to the LR days, and this time it's a case of a Caesarian section. Now this was during the end of my labor room postings, and after having done literally everything inside the labor room, I just wanted to get my hands on a Caesarian section. So it was in the early hours of the morning, around 4 a.m. a patient came and she was admitted in the emergency OT for a Caesarian section. Usually the final year postgraduates do the surgery and the first year postgraduates assist the case. I just took my shot and I asked the final year PG who was going to do the case, and I asked her whether I could just assist and sneak inside, and she was extremely kind enough. Now the thing about the obstetrics and gynecology department is it's really weird, I would say, in a sense that they are extremely chaotic at some moments, and at the other times they are extremely kind and helpful. This is one of those moments when the PG was really kind to me. She taught me how to scrub. This was my first time scrubbing for the operation. I scrubbed in and I had the opportunity to assist it. I once again went without any complications. The baby was delivered, and that was my first Caesarean section assistance. A final experience which I would like to share in this video happened during my second year, when one of my seniors, who was a house surgeon back then, he called me and my friend to come to the casualty and help them in their work, because it was a very busy day and there were lots of cases happening in the casualty. Casualty is one of those places where there is never enough staff to look after the matters. There is always a staff shortage. So we were in our second year and we literally had no idea regarding the clinical side or about treating a patient. He just told me and my friend to come, and we went over there, and the experience we had staying in the casualty for 4 to 5 hours was just phenomenal. We had the opportunity to control the triage, which is one of the most important parts of the casualty, where you have to segregate and divide the patients depending upon their severity of illness into red, yellow, green and black areas. So I did that job. Along with that, I had the opportunity to assist in suturing a broken scalp after a head injury, plus the wide variety of cases that we saw that day just in a span of a few hours. It was just mind-blowing. I saw poisoning cases, we had suicide cases coming up, we had snake bites, 2 or 3 of them, we had multiple cases of myocardial infarction, that is heart attacks, strokes, we had multiple accidents coming to the surgery department and in the ortho department. Plus one of the most horrific scenes that I saw that day was a burns patient. It was very horrific, the way that we learn about managing burns in our surgery, but on a real life the patient was in a complete agony. No matter how much analgesics and morphine was given to the patient was still crying in pain due to the burns, and it was a horrific experience. Having such an experience right during my second year is something that I will never ever forget in my life. So that's what I want to share in this video. If you liked and watched so far, just hit the subscribe button and share this with your friends. Plus, if you're a medical student, whenever opportunity hits your door, you should grab them. You should not shy away from taking your chances. You might be afraid that you might do mistakes, you might do blunders, but nevertheless understand that this is the time to make the mistakes. You are an undergraduate student. It's okay to make mistakes. There are going to be seniors, professors, everyone around there to rectify your mistakes, and in case anything goes bad, they are there to save you. But the memories, the experience and the confidence that you will build by getting into these opportunities and making use of them, it's something which cannot be said by words. So the next time when a PG or a house surgeon calls you for some work, take the call and just run towards it. If you're a NEET aspirant watching this video, what I want to say is study hard, crack NEET, because it's definitely worth it. The reason I had these experiences was because I studied in the best medical college in the state, and I studied in one of the best medical colleges across the country. We have more than 3,000 beds. We have such a huge patient flow, and that is the reason why I had the opportunity to get all this hands-on experience. So if you're a NEET aspirant, study hard, work hard. It's definitely going to be worth it, and the most important part, that is to subscribe to my channel. So until next time, it's Omer Mohammed signing off.